For patients receiving chemotherapy, nausea and vomiting can drastically reduce quality of life. In some instances, nausea prevents patients from taking life-saving treatment. Fortunately, anti-nausea and vomiting medication, called antiemetics, reduces the risk of nausea during these chemotherapy and radiation treatments. The American Society of Clinical Oncology maintains an expert panel consisting of medical doctors, nurses, and academics to make and update recommendations for how antiemetic drugs should be prescribed to patients during chemotherapy and radiation. On August 25, 2017, this panel published an update to its clinical practice guidelines in the Journal of Clinical Oncology. The previous guidelines were published in 2015, and there have been several updates since that time. Most notably, the guidelines now include the use of the drug Olanzapine and a new section on marijuana and cannabinoids. Olanzapine is a drug that was originally approved by the FDA as an antipsychotic. Research suggests that olanzapine's antiemetic effect comes from the dampening of the dopamine receptor D2 and two serotonin receptors 5-HT2C and 5-HT3. Olanzapine works best as an antiemetic when it is administered prophylactically as part of a cocktail that targets many neurotransmitter receptors. The updated clinical practice guidelines recommend adding olanzapine to the combination of drugs used to treat patients with a greater than 90% risk of experiencing nausea. It also recommends that patients who are experiencing nausea and vomiting, even after taking prophylactic antiemetics, add olanzapine to the medications they are already taking. Common side effects for olanzapine include sedation and weight gain. However, the recommended treatment cycle is short, up to 3 days after chemotherapy, and there is strong evidence that the benefits outweigh the harm. It is appropriate that the guidelines include a new section on marijuana and cannabinoids because of the renewed interest in their possible medical applications. Some states, like Colorado, produce a lot of marijuana and cannabinoid-containing products. However, the medical benefit of those products have not yet been fully explored. The cannabinoid receptor does play a role in regulation of nausea and vomiting, yet research into the effectiveness of modern cannabinoids as antiemetic agents for chemotherapy is limited. Most of the research reviewed by this panel was conducted between 1975 and 1991 and is largely outdated. There does not appear to be credible research that examines modern cannabinoid products or that compares medical marijuana to modern anti-nausea medication. Because of this, the guidelines say that there is currently not enough evidence to recommend medical marijuana or cannabinoids as antiemetics for chemotherapy or radiation. I expect this section of the guidelines will be thoroughly updated as more research comes out. For anyone who is still interested, I highly recommend you look at the full report, which contains recommendations based on risk of nausea, as well as tabulated drug dosages and estimated costs. It is available for free and is written to be useful to patients and non-experts as well as medical professionals. Neither I nor these guidelines can replace consulting with your doctor. However, I do think that the guidelines are a credible source of information on available antiemetic options. It can also help cancer patients develop better expectations about chemotherapy and radiation. Although there is a perception that chemotherapy and radiation cause high levels of nausea in most or all cases, modern antiemetics are disproving that belief. In an interview with Fred Hutch News, Dr. Gary Lyman, a member of the American Society of Clinical Oncology, said, "With rare exceptions, patients should not be vomiting with chemo anymore, and you only need a few days of anti-nausea drugs for most regimens."